people, welcome back to my channel. Thank you for subscribing, thank you for liking my previous videos. If you're new here, please consider to subscribe. There's more content awaiting you. We are continuing with the series of infertility, and today we have a nurse. She's called Fauziya Lugogo. She's going to take us through family planning and its relation to infertility. So welcome, Fauziya. Please introduce yourself.
Thank you very much for this opportunity. I'm humbled. As she said, my name is Fauziya Lugogo. I'm a nurse by profession. I'm here today to talk about family planning.
So she can just take us through now family planning. Let's start. What exactly is family planning?
Most people know there is something called family planning, but they don't really understand what it actually means. So family planning is actually a method that we women or even a man can take just in order to try and prevent pregnancy. And they are classified in several ways. They are basically the hormonal and the non-hormonal methods.
So briefly, just take us through the non-hormonal methods, just a brief mention. And by the way, I did a series on that, so you can check actually my previous videos to understand what we are talking about.
Okay, thank you. So for the non-hormonal method, there are several. There are the natural method and the artificial methods. So we look about the natural methods of the non-hormonal. The non-hormonal contraceptive, to begin with, they're this type of methods that they really don't have the extra hormones. You know, the hormones are the natural chemicals and all this that they're produced by the body. So these non-hormonal methods, they don't have these hormones.
So basically estrogen and progesterone, they don't have them.
Exactly, thank you. So an example of a natural one is one called LAM, which is the lactation amenorrhea method. And this is one of the methods that is mostly practiced by people the women who have just given birth, they are breastfeeding. It's a very natural and very affordable, and you don't need to go to the hospital for it. For all those mothers who have actually just delivered, you can have safe period of up to 6 months when you're using the LAM method. And what exactly is LAM is whereby you are breastfeeding mother, and it has 3 components that you have to oversee all of them. You have to practice all the 3 of them so that the LAM method can be effective. And the first one being, this mother has to be breastfeeding. Mostly we encourage it to be exclusive breastfeeding. You don't give your baby even a drop of water. You don't give them anything. You don't supplement. It is entirely breast milk. You could express, it's fine, but it is what? Breast milk. So you have to be exclusively breastfeeding. Also, you must not have seen your periods. Like, you know, after your delivery, you don't get period for a certain time. So as long as the period have not returned, then you're good to practice LAM. The third method is your baby has to be less than 6 months. When any of those 3 components is breached, then you have to look for an extra method to protect yourself. So another natural method is the coitus interruptus. Most people will know it as withdrawal, whereby during intimate moment, the man gets to ejaculate outside. So that is another natural method. We also have the barrier methods, which is also a non-hormonal way. For example, the use of condoms, CD. The other one will be diaphragm, spermicide, rings, and dactyria. I don't think this other method, they are really common in Kenya.
They're not.
For the barrier method, I think
condoms are the most widely used
over the counter, over the shop, you name it. But the other 3 are not so common. But she has another video, you can go there and
check it out.
See more. So the other method that is non-hormonal is the intrauterine device. Most people call it coil. IUD, IUCD, also the same method. It is actually one of the really very good method of family planning. It is not hormonal, and also it is a very long-term method, which is 12 years, up to 12 years of contraception. Another thing is that it is pretty good because, you know, when you don't use the hormone part of it, then your body gets to flow naturally, in that you don't get all those problems of over bleeding, of weight gain, loss gain, amenorrhea, all those things. You don't get those things. The only side effect could be spotting. Long-term use, maybe backache. And also
little bit of cramping,
by the way, to some people. And also another thing is that you need to go to the hospital to get the device inserted in you. It's not something you can get it uko inje or over the counter. You really have to go. And also some wombs, some uterus, they don't really accommodate the IUD. So you need to, when the health worker is administering that method, they actually get to measure how long your uterus is. Yes, from the fundus, like the very upper top part of the uterus, all the way to the cervix, like from up there to the cervix. If it is too long, the IUD cannot survive. It will get displaced. If it is too short as well, you cannot survive with it because it will get out. Also, some people who have like really bad heavy cramping, they also need to go for regular checkups because it could come out with the heavy menses. Another thing about the IUD, it is 99% effective. So all those people who like, some people conceive with the IUD, that is the 1% that is not effective. But it's actually one of the really best method because it is 99% and non-hormonal.
So we can talk about now the hormonal contraceptives.
Yes, thank you. So we go to the hormonal contraceptive methods. So these are those methods that you use to prevent pregnancy, but at the same time they use the hormones, and that will be progesterone and estrogen. So there are several. There are 3-4 methods. So actually there are 3: the pills and the implants,
and then the deep
and the injectables. So I'll start with the pills, if that's okay with you.
That's fine.
So we'll start with the oral contraception, the hormonal ones. They are categorized into 2, and that would be the COC, which is the combined oral contraceptives, sorry. And the second one is the POC, which is the progesterone only contraceptives. So we look at the COCs. They are the 21 days pills. If you see the packs, please, you'll have to go back to...
I'll insert a photo of how it actually looks like.
In the previous video she did. So it's a 21-day pills. That's the COC you're talking about, and it has a combined method. It has both the estrogen and the progesterone. So with this method, you take 1 pill every day, preferably at the same time. If you've decided to take it 10 a.m., 10 o'clock, please, it is advisable that you take it at the same time.
To add on that, it usually has like 7 red ones. So those 7 ones, they're not the COCs, they're actually iron tablets. So yes, after the 21 days, you're supposed to take them within within 7 days, in order just to complete your menstrual cycle if it's 28 days. They're important because they're just replenishing your iron, because you know you're going to have your period. So they're just replacing the iron that you've lost through your periods.
Very true. So ensure you don't miss the red tablets. They're tiny tablets, very important. So you take 1 tab every day. This method is actually really good as well, because the doses of the hormones are not really as much. At the same time, it also has some instructions on it, advantages and disadvantages. The advantage being you don't need to go to the hospital all the time. As long as you're eligible to get the method that is you're sexually active and you're not suffering other underlying conditions that I'm going to talk about them, you're good to go. So this method, somebody can take them at their own time, convenient time, and but you have to make sure that time is strictly at the same. It's constant. So that's just about it. You can buy the tablets over the counter.
I don't want to mention brand names because I'm not promoting anything. So just know they're combined oral contraceptives.
So that is one of the things. But it also, anything that has an advantage definitely has a disadvantage. So the disadvantage of this thing, main one, it is hormonal. So like we said, it has estrogen and progesterone. And these are hormones that can bring about a lot of, it's added hormones, so it can bring a lot of hormonal imbalance. It can tamper with your libido. Your sex drive can decrease. Weight gain, weight loss, acne. Amenorrhea, you can miss your periods over a long period of time, or you can have heavy menses. And then also the fact that it contains estrogen. The work of estrogen. It helps in development of the female secondary characteristics of a lady. So if it will maybe enhance the growth of your breasts, it will enhance the growth of the cervical mucosa. That's why sometimes we've seen studies that are linking actually the combined oral contraceptives to maybe breast cancer or something of the sort. This is just because of the action of estrogen, on your body, on your system. Very true. To add on what Dr. has said, this method, it is contraindicated for some people. Let's say if you have breast cancer, if you have DVT, if you have sickle cell.
DVT is deep venous thrombosis.
Deep venous thrombosis. If you have if you are a sickle cell disease, it is also contraindicated to some people who are on anti-TB medication. For people on anti-TB medication, you will need to follow up with your physician to get to learn more about this, because anything that has a drug by the name rifampicin, it normally lowers the dose. Therapy, ARVs with ritonavir, it is also contraindicated. So it has a whole list of also for people who are on mood stabilizers.
Like lithium.
Exactly.
Something used to treat bipolar disorder.
Also something like anticonvulsants. Some anticonvulsants you can take with this drug. So it also has its own disadvantage. Just to mention another advantage that I actually just remembered, it also, some doctors prescribe it for people who have polycystic ovarian syndrome. It's also one of the medication for even people with severe acne. You'll find they are recommended to take the COCs, but please don't self-prescribe. When it comes to these conditions, you need to be
seen by a doctor,
for them to tell you about it more. So
it's also used actually to treat some menstrual cycle disorders. You can find out that maybe you have issues with your menstrual cycle, then they give you those combined oral contraceptives, and they actually sort that
Very
out.
True. So I think that's all about the COC. We'll go to the progesterone only contraceptives. As the name says, progesterone only. So this one doesn't have the hormone progesterone. It doesn't have the hormone estrogen. It only has progesterone hormone. So one thing about this, the tab, it's also a pill. You take one every day, preferably the same exact time you set for it. It is a 28-day pill in a packet. So every day for your whole cycle, you get to have the pill. One advantage of POC, the progesterone only, is that it is very good for breastfeeding mothers. It doesn't have the estrogen component. So like Dr. had said, estrogen interferes with
your hormone
for the women. So for women who are breastfeeding and you want to add an extra contraception, it is best to use the POC. It's one of the methods that you can use. So Also the POCs, because estrogen really has a lot of complications, and it is contraindicated in so many conditions.
Yes.
So POC is rather a bit safer.
Yeah.
So
maybe if someone has deep venous thrombosis, maybe if someone has breast cancer, maybe, such conditions, that's when you can be given POCs.
POCs, that's where it chips in. So and also the side effects of POCs are a bit lower as compared to COCs. So that being said, it's disadvantages and advantages. We have already stated them out. Also, one of the advantages, they're basically the same as the COC. You can just buy it over the counter and take it every day. It has less side effects, so it's just like that. So maybe the other method, we will go to the injectables. So for the injectables, we have two of them, especially upper Kenya. We have the Jadel and the Implanon. So these are there are two different type of injectables. We have for the Implanon, it is a 3 years long-term method of contraceptive, and it only has one rod. We normally administer it on the arm, like you get this part. That's where we normally insert the Implanon, mostly in the dominant hand, because so that you cannot use it. If you are a righty, we put it on the left. If you are a lefty, we put it on the right. This is because unajua saa zile unasugua masufuria with your right hand. You don't choose to emit, the more you use that hand, it emit more doses. It could even end before your time lapse. So if you are a righty, it's administered on the left, the dominant hand, the one that you don't use frequently. So the 3 years one in the Implanon is normally our one rod, and the Jadel is two rods for 5 years. So that is just the difference. Otherwise, they work almost the same way as the oral contraceptives, because they are all hormones. And they are also safe in many ways. The same way it offers contraception. So the next thing we'll talk about is the ECP, the emergency contraception. Most people know it as P2
or EC2. We are not advertising any brand.
EC2, E-pill, morning pill, morning after. It has so many. You name it, you name it. So basically, what I can tell you about the emergency pill is when you've had your unprotected sex and you realize, oh shoot, I'm not ready for pregnancy, and you need to do something quick, because maybe you've not been on any method of family planning, and be it or sometimes it's not like you just messed up. Sometimes it's more like a condom burst. But you tried.
Let me say something. When I'm working at the pharmacy, most of you come and then you tell me, oh, condom will burst. But I look at your faces and I'm like, you're lying. But anyway, it's okay. It's on a light note.
It's just a joke for the day. Don't be shy to go to the pharmacy for it. So a condom could burst. Things happen. Shit happens. Or some people get into trouble. They get into scenario whereby they are coerced sexually.
Or maybe you're raped.
Or raped. So even in the clinic, when somebody comes with a coerced rape complaint or a rape complaint, what do? E-pill. E-pill before all those legal actions. So this E-pill, they are of two types as well. We have the one that is combined. It has both estrogen and progesterone. But there is the one that is just a progesterone only. Progesterone only.
And that's the common one.
In Kenya, the common one is the one that has only progesterone. And its dose is very kidogo. It's just 0.75 milligrams. And it's normally 2 doses. So you can take it in 2 ways. You can either take one pill, swallow it, after 12 hours, you do the next pill, or you can just take, it's normally mostly comes in two pills. You just take the 2 2 pills at once.
Yeah.
So with the e-pill, the only thing is that people need to understand, you can only take an e-pill within 72 hours.
Yes.
After
all which, just get pregnant and move on.
Yes. So after you've messed up, or whatever happened between you and your partner, and you need the emergency contraception within 72 hours is when you can take the e-pill. Remember, the earlier the better.
Yeah.
You had sex now, unprotected sex, go ahead, have your e-pill immediately. The earlier the better.
A caution.
Yes.
You're not supposed to take more than 1 pill per cycle.
You see?
The recommended one is 4 P2. You're supposed to take only 4 per year.
Yes.
But then I see people taking P2 like njugu. Honestly, you're hurting yourself, and we'll talk about the effects of P2 later, and you'll come and see how you're harming your body. Yeah. So just make sure it's 4 per year. Don't take 4 in 1 month.
Yes.
Because there's this period in your month where you're actually safe. We actually forgot to say like the safe days.
Oh, yeah,
you can use your safe days,
Yeah,
instead of pumping yourself with a lot of P2. You can use your safe days.
The e-pill normally has a very kidogo dose, and that is 0.75 milligrams, and that is for the 1 tab. So for a dose you need to take 1.5
milligrams.
1.5 milligrams for a dose, as a complete dose. So if you know, I'll just ensure I warn you, like the way she said, if you know you're about to mess up quite oftenly, it is best you consider
a long-term
contraceptive or a daily pill contraceptive. P2 is not a contraception. So that is about the P2.
We can talk about now the depot.
Okay, the injectables.
Yes, the injectables.
So the other method of the other classification of hormonal contraception, we have the injectables. So for these injectables, we also have several. There is the the COC only and the POPs, but normally in Kenya we have the progesterone only injectable, and that is the depot. You know, the one that people go for 3 months, that's the one. So this is an injection that people get every 3 months, that is 90 days. So this it's one of the method that I would say some women from especially these very strict religions and cultures, they use this
that.
Is because there is no evidence, there is no mark. It's just an it's very it's a very secretive method. It's not like the pill, there are these cultures and religion, they don't allow you to use
contraceptives.
So if you have a pill, somebody could see it, or so
if you have the mark here, someone could actually see that
the implant, somebody can actually see it. But some people, they opt, they know I'm not supposed, and no judgment. If you feel you need to have a method of contraceptive,
that's okay.
That's okay.
As long as it fits the criteria.
Exactly.
It's fine.
So some people, they'll go for the depot, which is the injection. It's a 3 months one. So about depot. So it's a 3 months injection. So one thing about it, like we said, it's very secretive. That is the advantage. It's also breastfeeding friendly because it doesn't have the estrogen, so it does not suppress breast production, milk production. So it's very safe for breastfeeding mothers, and it's actually also good if you cannot practice the LAM method. You can always go ahead and get the injection.
So we've actually covered all those contraceptives, and I'd just like my viewers to know, how do these contraceptives actually work?
Okay, so basically these contraceptives, most of them have the same mode of action. So they normally help the sperm not to get to the ovaries in the fallopian tube in several ways. One being they thicken the mucus. Most people would wonder where is the mucus. The mucus is in the female vaginal part. There is a lot of mucus in there. In any lining of the body inside, it is covered with mucus for protection. So it thickens the mucus. So when the mucus becomes so thick, the sperms cannot go through. They cannot penetrate to where the ovum is, the egg. So another way is that it thinnens the endometrium, and that is the wall lining of the uterus, whereby if in case the sperm and the ovum had already met and the fertilization has taken place, for example, the ovum, the fertilized egg, needs to actually come to the wall lining of the uterus and attach for implantation and for the baby to grow. So normally the wall, the endometrium, needs to be very thick for that implantation to take place. But the contraceptive methods, they actually thinnen that wall, the endometrium, so there is no way implantation can take place. So that is how most it happens. And for the hormonal ones, they signal the brain to stop the other hormones that maintain pregnancy, like the follicle stimulating hormones and the luteinizing hormones. That could, maybe she could do a series on that.
Another do a series on pregnancy after this. Okay, so we've looked at the mode of action. Now we look at the side effects of contraceptives in general and how we manage those side effects.
Thank you. So most of these side effects, they have common side effects. Most of these contraceptives, they normally have common side effects. Like, let's look at the hormonal ones. The hormonal ones, anything that has hormone will definitely play tricks with your body. Hormonal imbalance can cause, like we had earlier mentioned, lack of period. You could not see period for months, which medical term is the amenorrhea. You could also have very heavy menses, non-stop, which you could also have acne breakout. You could have something like cramps. You could have mood swings, all weight gain, weight loss. It could also bring issue in your marriage or your relationship, because it also tampers with libido. Most reduces the libido, the sex drive. Some people, it also make them extremely dry during coitus, so it makes it very not really enjoyable during when you're having a moment with your partner during the coitus. So
nausea, vomiting.
It also, like any drug, the most common, NVD, nausea, vomiting. Any health medical student, they will tell you NVD, you can delay. Nausea, vomiting, and diarrhea. It's very common in almost all medications. So that is one of it. So how to manage it, you just have to understand these things are common, they are normal. Most time you have to deal with it because it is what it is. If one method does not work out for you, let's say the hormonal, the side effects are so intense, you can opt to go for the natural or for the non-hormonal. But for the heavy menses and the cramps, we normally administer high dose of steroids, ibuprofen, NSAIDs, Oh, it's non-steroid.
Non-steroidal anti-inflammatory, like brufen, diclofenac.
Yes. So the best one and recommended is high doses of ibuprofen. That is 800 milligrams, 3 times a day for 1 week. That is like 8 tablets. Depends, but it is 800 milligrams, 3 times a day for 1 week.
That's like oral.
Oral.
So a caution about this type of drug. So if you're taking brufen, sorry, I'm not mentioning brand names, ibuprofen, diclofenac, aspirin, all those drugs have a tendency of causing ulcers. So what you do, you take with meals, or you can use omeprazole, which will actually protect your lining of the stomach, and it will prevent you from having ulcers. She can continue.
Better yet, you have these severe symptoms, and side effect, just go back to the clinic so that they can do a proper assessment. You know, somebody could have peptic ulcers.
Yeah, it's true.
So it's good to always go back so that they can rule out even other underlying issues. So yeah, for the IUD, the backache, you can just take the normal painkillers. Yeah, for
this massage. Tell your partner to rub your back.
Yeah, you're not taking all those shots for free.
I know, he has to rub your back.
Yeah, he does. So yeah, so basically that's it about the management.
So now we can actually now look at our topic for the day. We've just gone round and round. So here it is. Let us talk about hormonal contraceptives and infertility. Since I've actually seen so many women complaining, I've been on this contraceptive, and then after I've removed it, I'm not able to even get a child, even up to 2 years. Some even take 5 years. So you can tell us more about that. Do actually hormonal contraceptives cause infertility?
Thank you. Well, this is actually a very a huge concern to so many people. It is a concern that is really worth to question yourself. Let's look at it in different angles. Okay, for the LAM method, the natural method, they do not cause any infertility.
Yeah, it's natural.
With using of condoms, barrier method, you want to get pregnant, don't use the barrier.
Yeah.
For the IUD, it's the longest method, which is 12 years IUD. You want to get pregnant, remove the IUD, fertility comes back immediately.
Yes.
Which other one? For ECP, for the emergency drug, in fact, you don't even need it.
You don't need it.
You want to get pregnant, just have a lot of unprotected sex, and you're good. So the other method, now we'll go to the hormonal. The hormonal methods, that's where the question marks and the worries and the queries come in. I will start with the longest method, which are the hormonal, which are the implants, and that is the Jadel, the 5 years one, and the implant on the 3 years one. Let me just mention that the dosage of this implant is 75 milligram, and that's not really much. Normally, when you're ready to conceive, stop these methods, the contraceptive ones, and you start taking drugs that prepare your body for, welcoming the baby.
Preconception.
Yeah, the preconception. You could start taking the calcium, you can take the iron and the folic acid. These are the things you take. You also need to take balanced diet and plenty of water to wash out this hormone. You also need a lot of exercise, by the way, you're trying to build back your body ready for the baby. So for the implants, they don't really have a known record of, yes, they're hormones, they have other side effects, but infertility is not one of them. However, we can check now the
culprit for the day.
Yeah, indeed, the culprit. So we look at the oral contraception. Let's look at these doses, okay? The ECP, the E-pill, has 0.75 milligram. That is like really little dosage. And ECP normally don't really cause any infertility because the drug works under a short-term method, and it normally clears out within a short time.
But a caution, when I was saying you're not supposed to take like 4 P2s or 4 emergency contraceptives. Sorry for using the trade name. You're not supposed to take 4 emergency contraceptives within 1 month. Yeah. This is because there's some studies that have actually been done, and they correlate emergency contraceptive to ectopic pregnancy.
Yes.
And that is how the infertility comes about. And an ectopic pregnancy comes about when the egg and the sperm, they're usually fertilized in the fallopian tube. And the fallopian tube is such a very small like tube. So when the baby starts to grow on the fallopian tube, it can burst. And then you have 2. So if both of them burst, you're highly likely to get infertile. So that is the correlation. That is why I always tell you, P2 wachana nayo. If you want like contraception, go to
ahead.
the long term. Yeah, go to the long term. They are much safer than P2.
Yes.
Yeah.
Also, another thing about to add on that about the e-pill is basically what happens is the more you use it, that is abuse.
Yeah.
And effectiveness reduces. So it will backfire one day. You use it too much, your body will not take it anymore.
Yeah.
It will, and that's why you hear people saying, I use that P2 but I'm pregnant. So yeah, so that's what happens. So you don't need to abuse it. If you feel like you're going to have a lot of unprotected sex, go ahead and use other method of contraception. So, and also about the other one, the COC and the POCs, they do have hormones, but the rate at which they induce infertility is almost not recorded, because the minute you want to gain back your fertility, you just stop taking the drug, give your body a bit time so that it can wash out the drug, and you're good to go.
Yeah, and then it also depends on one woman and another one.
Yes.
For me, I can take I can stop within 1 month, I conceive. For you, you can take like 6 months, another 1 year. So it depends, and don't compare yourself to another person.
Yes.
Yeah.
So, however, moving on, the one that has had a lot of this myth about like infertility and all those issues is the injectable Depo-Provera. So, Depo-Provera has had a record of women have had complaints. They stopped taking it years ago and still can't conceive. And the main reason is that this injectable, it's a very small dose for 3 months, but it is heavy. Yeah. The content is a lot.
It's a lot.
150 milligram in just that 3-month dose. Like, compare it this way. The implant that stays for 5 years has only 50 milligram dose, and this one injection for 3 months has 150 milligrams.
So you can imagine 150 milligrams every 3 months.
How much have you pumped in your body? System, you know. So it's the one that some women, like she said, different women respond differently. Some people, they want to conceive, they stop the drug and they're good to go. Others, they take long. In fact, in my own personal experience, I've met somebody, the highest I've had is 12 years.
What?
Yes.
Like they stopped using that, and then 12 years later they don't have a...
They've been trying to conceive for 12 years. It was one of my clients, and I've seen 12 years, I've seen 10 years, I've seen so many years. And I've also seen those who they just stopped the previous month and they conceive. But it's the one, Depo is the one that really has
like issues.
The issues.
3 months injection. So guys, as you're going to get your contraceptive or your contraception method, make sure when you're going for the 3 months injection, you don't want like babies anytime soon. But if you want anytime soon, you can take the other ones. But for the 3 months injection, make sure you're really sure that you don't want a kid anytime soon. Yeah, because you see, this could also bring issues in your marriage. It should cause for you a lot of issues.
It does.
Yeah, so I'd advise you, before you take any contraceptive, make sure you seek your doctor's advice. Make sure you go to a doctor so that they take you through that criteria so that they can get the best one for you. Don't use the 3 months injection because my sister is using, my friend is using. No, everyone is different. Yeah. Also, the last category that causes actually infertility, we have the permanent methods of contraception, which I can term them as sterilization. She can take us through them.
So we also have this permanent method, and there are also the surgical method, whereby you have to go to theater to actually undergo this method of conception, and that would be the BTL and the vasectomy. Which is the BTL is for the women, the fallopian tube are cut and the vasectomy is for the male, whereby the
vas difference of sperm duct.
Sperm duct is cut. Thank you. So the only thing I'm going to touch on that is that some people are very unfair when it comes to this method of contraceptive. You know, you get that a man will tell the woman, go ahead and go cut your fallopian tube so that you... Well, it is an in-house communication.
Yeah.
You and your husband, you and your partner are going to have to sit down and agree.
Yes.
But one thing I normally advise my family, my friends, my clients, it's not just a method you need to wake up one day and feel I don't want kids, because it is a permanent method. In that, once you cut those ducts, those tubes, it is irreversible.
It's irreversible.
But I've heard that there's some people who have had they've managed to have babies even after vasectomy.
Unless you use the assisted methods of reproduction,
like
IVF and the IUI, all of them. I'll discuss them in another video, so it's also possible. So
I think
I think that's it for this video, and thank you so much. Please subscribe to my channel. This is how I want to start earning my money, because times are tough.
Are you serious? Are you gonna put that?
Yes. So make sure you subscribe to my channel. Make sure you watch my videos. Make sure you leave a comment. If you have any question, by the way, leave it in the comment section. Let us engage.
Yes.
Thank you so much. Thank you for my guest for coming. Thank you for your time. And if anyone has a question, you can also reach out to her. She can tell you how you can reach out to her for questions.
Thank you. It was a pleasure being here. I am humbled, and it was nice talking to all of you. I hope you learned a thing or two.